Transforming care through genomic medicine, personalized therapeutics, health services and outcomes research, and innovations in healthcare delivery. We're Children's Mercy Kansas City, presenting our audio interview series, Transformational Pediatrics, with host Dr. Michael Smith.
So obviously, prevention is always better than treatment, right? Especially when you're dealing with type 2 diabetes. This is Transformational Pediatrics, the podcast from Children's Mercy. I'm Dr. Mike. Let's talk with Dr. Kelsey Halpin, a pediatric endocrinologist at Children's Mercy and assistant professor of pediatrics at the University of Missouri, Kansas City School of Medicine.
Yeah. Thanks for having me, Dr. Mike.
So what prompted Children's Mercy, specifically the Division of Endocrinology and Diabetes, to create a type 2 diabetes prevention clinic?
Yeah, that's a great question. So this clinic came about about 5 years ago. The current clinic director, Dr. Yunian, and our division leadership, they put together this clinic just because we were having a growing number of kids that we were seeing being diagnosed with type 2 diabetes, which is classically thought of as only an adult condition, but we're seeing more and more of it in recent years. And just essentially the sheer number of referrals we were getting for children because of abnormal weight gain and concern for type 2 diabetes risk. And so, right now there's 1 in 5 kids in America that are categorized as obese. And so the things that go along with that, like insulin resistance, metabolic syndrome, prediabetes, those are actually some of the most common referrals that we get to our clinic. But when we see these kids, a lot of times we're seeing them for counseling and evaluation before they've had any sort of formal nutrition or lifestyle education. And so we would see them, we'd refer them on for a separate visit with a dietitian. And those separate visits just require more travel, costs, missed work, school burdens, and things like that for the family. And so really this clinic was developed as a multidisciplinary approach with both endocrinology and dietitian services in the same day, and also incorporating social work if needed. And so it's just a way to sort of streamline the care for the patients and just seemed like a good idea for our referring providers as well as for our patients to set this up.
It's interesting, right, Dr. Halpin, that this is relatively a new issue that we're having to deal with. I don't know how old you are, but I grew up in the late 70s, early 80s, and I don't remember ever hearing of a friend of mine with type 2 diabetes. Yeah, there were a couple with what we called back then juvenile, right, type 1 diabetes. So this is kind of relatively new that we're now seeing type 2 in younger kids, right?
Yeah, absolutely. And obviously it's kind of a consequence of higher rates of obesity in children in general. But there's a lot about sort of this juvenile type 2 that we're seeing in recent years that we don't fully understand why it's happening so much now that we know it's related to higher obesity risk. But you're exactly right. A couple decades ago, this just wasn't on anyone's radar. At Children's Mercy at our center, we follow over 2,000 kids with diabetes in general. I would say it's about 200 of those are type 2 diabetes patients. And so it's certainly not the most common form of diabetes in kids, but we're still seeing it in substantial numbers. And unfortunately, the recent evidence coming out shows that it actually tends to be a little bit more rapidly progressive and severe than your older adults that get type 2 diabetes. So it's kind of a different thing that we're tackling now.
So, back to the prevention clinic, what types of patients are appropriate for community physicians and healthcare practitioners to refer to the clinic?
Yeah. So we're really trying to prioritize those referrals of kids that are already starting to show some lab abnormalities that suggest they have a diabetes risk. So whether that's their blood sugar is a little high, but maybe not in that diabetes range, they've already got high cholesterol or signs of fatty liver disease, those kids that are in those high-risk groups. So those are kids whose moms and dads have type 2 diabetes, or are racial minorities that we know are at higher risk. And so we're really trying to get those kids in. We also kind of have a focus on very young children, so children under 5 that are struggling with severe rapid weight gain. And because in that instance, they may be at higher risk for underlying genetic or hormonal condition. And so really kind of an evaluation of that. If I'm being honest, this clinic would be helpful for any of the referrals that we see for abnormal weight gain, just to discuss diabetes risk. The tricky part is we get probably 1,000 plus referrals a year for patients, or at least see 1,000 patients a year for that. And so we, just based off time and space, we're really trying to prioritize those children at highest risk into this multidisciplinary clinic. And our website has the details as far as specific lab criteria and age and things like that.
You mentioned earlier in our conversation about, a patient can actually see a lot of professionals, health professionals at one visit. How about if you walk us through what that first visit to the clinic actually, looks like, and what the patient experiences?
Yeah, the first visit can be a little bit lengthy, just because that's kind of what's expected with some of these multidisciplinary clinics where you're seeing multiple providers. But we try and streamline it as much as possible. And so normally when they come, they check in just as they would for a typical, provider visit. But that we do have the capability, when we're doing vital signs and things like that, we also have a very specific scale in the clinic that helps determine muscle mass, fat mass, which is not something we do routinely as part of our standard of care, and provide some more data collection. But then, depending on the flow, they'll either meet with an endocrinologist or a dietitian first. And usually they're meeting with each of us for 30 to 40 minutes. So a pretty lengthy amount of time that they're seeing us. And our dietitians are really uniquely qualified just because they're all certified diabetes educators as well. So they've already got experience with children who have type 2 diabetes. And so they're really able to sort of uniquely hone in on some modifications that the families can make to hopefully prevent that from happening. So they'll meet with them and chat with them. And then our role as endocrinologists is we're really trying to explain to families the hormonal and genetic causes of weight gain and the health consequences that can result if we don't intervene appropriately. And so we're really doing our best with our specific expertise to help the families understand insulin, this sort of spectrum of insulin resistance, pre-diabetes, on to type 2 diabetes, is very complicated. It's not just lifestyle, though that's the cornerstone of all our interventions. And so we try to help them see that there's a lot that plays into it outside of that. And also, the families usually can expect, if they haven't had recent lab work done, we'll probably recommend some fasting lab work be done at that visit, or when they can next be fasting. And we also, we are pretty proactive about genetic testing. So in those young kids I was talking about, those kids under 5, or if we're seeing children at high risk for diabetes that also have some other neurocognitive or developmental delays, we're pretty proactive about sending genetic testing off for some syndromes that can cause that risk as well as those features. And so that's kind of the first full visit that they'll go through. If we encounter any sort of social or environmental barriers that we feel like are impairing their ability to maintain a healthy lifestyle, we also have the option of bringing in our social workers to meet with families as well. And after that first visit, the follow-up kind of depends on how that goes, but almost all of our patients come in for at least a 3 to 6 month follow-up where we can sort of see their progress just with counseling alone. And then at that point is when we may start talking interventions with medications and things like that if we're seeing progression of their lab abnormalities.
So what's the, when you look at the type of patient child you're bringing in, these are kids, if I got it right, that are already showing some changes, some abnormalities, whether it be blood work, weight gain, whatever. What ultimately then is your goal moving forward for this clinic?
Well, I mean, our hope is obviously with all of our care is providing the best absolute health care we can for patients while providing convenience by allowing them to see us and a dietitian expert in a single visit. We want to prevent the development of type 2 diabetes. That's why it's called type 2 diabetes prevention whenever possible. Though honestly, that's a big undertaking, just because like we've talked about, the type 2 diabetes in youth can be more aggressive, and we are limited by the fact that there's no FDA-approved drugs in children for pre-diabetes, so before you go on to develop type 2 diabetes. So this clinic, in addition to providing care and counseling and intervention for patients, it's really letting us standardize our approach and our data collection. And with that, we can really start digging into research of risk factors for these kids who are progressing in effective interventions. So as part of this clinic, we're already collecting outcome data. We're collaborating with other areas at Children's Mercy, including our Genome Center and Precision Therapeutics, and trying to really understand some of these genetic contributions to diabetes risk, and also just strategies for enhancing the efficacy of our interventions.
That's Dr. Kelsey Halpin. She is a pediatric endocrinologist at Children's Mercy. I want to thank you for checking out this episode of Transformational Pediatrics. Please visit childrensmercy.org to get connected with Dr. Halpin or another provider. Hey, by the way, if you found this podcast helpful, share it on your social channels, and be sure to check the entire podcast library for topics of interest to you, and be sure to check back soon for the next podcast. I'm Dr. Mike. Thanks for listening.